Hi, Janae. Janae is standalone superwoman by herself, but she also happens to be the wife of Dr. Rob CYWES, carb addiction doc, that all of you know and love, I'm sure. And so just a reminder that if you've got any questions for Janae, please, she's got such an important topic that she's talking about, something we need to talk about more and more, put them in the chat box. And so Janae considers her most important jobs being a mother to Rion, beautiful Rion, and a wife to Rob, carb addiction doc. Above all else, that is what brings her the most joy and pride. Before those significant jobs, Janae studied health sciences at University of Wyoming, completed a Bachelor of Science and Masters of Science in Speech and Language Pathology. And she worked as a healthcare practitioner treating people with speech, language, voice, cognitive, and swallowing disorders. And I can tell you, working in the stroke unit, just how invaluable your role would have been or is to those people. In 2014, Janae began working for a healthcare IT company that specialized in imaging informatics. And then further to that, she now works for a company called Meritive. She's responsible for selling cardiology, radiology, and cloud software. And her low-carb journey started in 2015 prior to meeting carb addiction doc, but has evolved from that point. She was almost purely carnivore when she conceived Rion and stayed ketovore throughout her pregnancy. That's amazing. And Janae and Rob CYWES are raising their 2.5-year-old son on a ketovore diet and feel very blessed that he is a happy, energetic, and thriving child. Welcome, Janae. We can't wait to hear you speak.
Great. Thank you so much. That was such a great introduction. So let me see if I can figure out the technology. I work for a healthcare IT company, but I can't claim to be good at IT. So let me just see if I can get my slides going here. So again, thank you so much to be part of the Nutrition Network Health Symposium is just such a great honor. I actually come from corporate America, which is why I always have 2 cell phones with me, and I'm not advocating that as a way to live life, but it is what it is for me these days. So again, I just really appreciate the opportunity to be with you today. As I was putting together this talk, I just naturally started making the PowerPoint slides, and the first thing I wrote on it was agenda, because you know, every time you have a meeting in corporate America, you start with an agenda slide. So normally, if this were a scientific or a healthcare talk, you would see a slide here about your learning objectives, but I thought in the spirit of comedy, I would leave it as I started making it, because I'm so used to now making slides that are agendas for meetings. So the agenda for our meeting today is going to be, I'm going to talk through who I am. We're going to talk a little bit just in general about nutrition and pregnancy, and then my specific nutrition and pregnancy, and also the care that pregnant women normally undergo. Then we'll talk about birth and postpartum, which I am very passionate about. And finally, we'll end with infant and toddler nutrition. So that's really what we have lined out for today. So when I was first reached out to by, I think it was Candace, I think it was Candace and Vandana to give this talk, they actually asked me, I think there was actually a phrase in the email that said, we're getting together a group of global speakers who are industry experts and have a knowledge base in the field of women's health. So I literally laughed out loud, because I thought that they had mistakenly sent me the email instead of Rob. So that was my first reaction. And then I read back again and I realized, oh, they actually want me to give this talk. And I thought, I really have no experience in this topic whatsoever. I can't believe they would say industry experts when they were asking me to do this. So I had a lot of hesitation around it, but I decided, I talked with Dr. Rob CYWES, that he is my husband, the carb addiction doc, for those of you who know. And we decided that my story really could have value to others. And I feel like if it helps at least one other person, then it's worth it. So we decided we would go ahead with responding to the request for me to be here today. And just one other funny note is that I actually specifically chose this PowerPoint template to go with my talk today, because it looks sort of scientific. So you can see it looks like I'm doing sort of laboratory experiment here or something. So that's about as much science as you're actually going to get in this talk today. And we'll see how that does by us. So, okay, who am I? So as the introduction said, I am a former healthcare provider. When I was young, I wanted to be just like my older sister, and she was a physical therapist, or as some of you in South Africa know, as a physiotherapist. And I really wanted to do everything just like my sister. So I wanted to be a physical therapist. And then I realized I can't stand seeing people in physical pain. So I didn't think that was a good career anymore. So instead, I went for a very similar career called speech language pathology. I think those of you in South Africa refer to it as logopedics. And I ended up getting both my bachelor's of science and my master's of science from the University of Wyoming. And I really loved helping people. Kind of funny that I went into the field because I wanted to work with children, because as I finished my graduate degree, I realized I didn't want to work on the childhood side of the field at all. So I ended up helping mostly geriatrics. But I really loved what I did. And I did that after my master's degree from 2006 to 2014. And like a lot of healthcare practitioners, and probably a lot of you who are watching this, I became very disillusioned with the productivity and paperwork requirements that were being pushed upon us. I remember one time I went to work for a company doing PRN, just as needed speech therapy. And I was told that I had to clock in, and within 3 minutes, I had to be on my iPad with my patient. I had to finish the entire session, all the paperwork within the time that I was sitting with the patient. So this entire note that had all these check boxes and all this free text and everything had to be done while I was with the patient. And then I had to sign out of the note, walk away from the patient, and I had 3 minutes to be with my next patient. And then 3 minutes with the next patient after that. And when I was done with my last patient, I had 3 minutes to clock out and be out the door. And that was really sort of the point in time when I said, this is not why I went into this field, right? I really wanted to help people. So I actually left the field full time. I was still doing a little bit on the side, and I went to work for a healthcare IT company selling imaging software. I started in customer service. And then more recently, in about 2016, I went into sales. And I always told people that my sales career was going to end at Girl Scouts. And at the time, I didn't realize I was selling diabetes and obesity to people. But anyway, here I am back in sales, hopefully not selling diabetes and obesity. And as she also said, my most important job I really see as being a mother to Rion and a wife to Rob. So that's really me in a nutshell. I am a bit emotional, and this topic is very obviously important to me. It's my whole world. So please forgive me if I get emotional during the talk. And I just want to put the caveat out there. I am not a scientist, but I am married to one. And I'm certainly not an expert in pregnancy, birth, or motherhood. And this presentation today is really my research study, that my N of 1. And I'm not advocating that anyone else follow this journey. This is really, at the end of the day, I'm just a storyteller, and this is my story. Okay, so let's talk a little bit about nutrition in pregnancy. So when I went to the OBGYN at 11 weeks, I was provided this handout on what I should be eating during pregnancy. And you can also see the reference to my plate up in the corner, which most of you know that is the current day food pyramid, which makes absolutely no sense for those of you who are probably already watching this and know a lot about the lifestyle that we promote. So that was really the newfangled way to talk about the food pyramid. So I brought this handout home for Rob and I to laugh at, basically. We literally, like, our jaws just dropped and we couldn't believe it. So I hope that this picture is showing up big enough for you to all see. But basically, we looked at this, and now even going back to look at this afterward, there was only one thing on this entire sheet that I actually ate during pregnancy. So I'd be curious to see, because again, I don't know if you can see it big enough. I'm assuming you can, but if you look at the granular details of it, there was only one thing. And I will tell you that one thing is actually egg, and egg is on the list. Now you'll see other things like protein, but you can see here that they talk about lean protein, and you can see dairy, but they talk about low fat, no fat dairy. So really, if you look at the entire, the totality of what's here that's being presented to me as what I should eat during pregnancy, I only ate one thing on this entire list. And I think it's also important to note that they say somewhere between 50 and 90% of women experience food cravings during pregnancy. And I'll talk about my specifics, but bottom line is I did not have one. I did not have one food craving ever during my entire pregnancy. Okay. So let's talk. Now, this is supposedly what you should eat during pregnancy. Okay. Let's see what I actually ate during pregnancy. So, as we talked about, I remained ketovore throughout the pregnancy. I was nearly strictly carnivore when I actually conceived Rion. Throughout the entire pregnancy, I drank a glass of whole milk daily. During the first trimester, and I think a lot of women experience this, especially what I've come to know as some of the other, pregnant women in the keto carnivore community really had some aversions in the first trimester. And my aversion was to red meat. So I really couldn't eat any red meat in the first trimester, which is such a shame because we eat red meat probably 4 or 5 times a week. So I didn't eat any red meat during the first trimester. And I really had that nausea from about week 7 through 16. So I had a good 9-10 weeks of nausea. So during that period, I really ate more vegetables. That's why I say ketovore with the capital Vor, because I really started out carnivore. Then first trimester was probably more keto. I mean, I definitely was. I still was having chicken and a little bit of fish, but I was definitely eating more vegetables than I ever had really since I met Rob. And then in the second and third trimesters, I was mostly carnivore again, and I was really eating 2 meals a day. During that time, I was eating a ton of fatty meat, eggs, bacon, cheese. I mean, you see here, the first picture here is basically kind of what first trimester was, and these were second and third trimester. So here, first trimester, I might have had, a salad with some grilled chicken on it or a salad with some grilled fish on it. I was definitely leaning more towards the vegetable side of things. Then I was going to, you see here, one of our favorites is ribeye with brie cheese. You can see the brie cheese here, bacon and eggs, obviously, in the morning or whatever that first meal of the day is. So this really kind of sums up how my pregnancy went. I did have coffee with heavy cream a few times a week, not because I was trying to avoid coffee. A lot of times when you, again, like the nutrition sheet that they gave me, a lot of times you will see a mention of things that you should avoid during pregnancy, and sometimes caffeine will be on that list. So I wasn't avoiding caffeine or coffee because of that reason. I didn't desire it like I usually desire now. So now I'm a 1 cup a day person. Everybody who knows Carb Addiction Doc knows he sips on coffee all throughout the day. He absolutely loves his coffee. I'm just really a 1 cup a day girl. And, but then when I was pregnant, I really was just a couple times a week for no other reason than, again, I just didn't really feel like it at the time. If I did have coffee, I would have heavy cream in it. And I come back to the fact that I had absolutely no food cravings. I did not crave ice cream. I did not crave potato chips. I did not crave anything. I didn't crave meats, veggies, or carbs, anything. I had not a single craving, which actually made for a very pleasant pregnancy. And then also, I think it's important to note that my blood glucose readings throughout my pregnancy were between 65 and 88, and my ketone readings were between 0.8 and 2.9. So I think that's important for people to know who are really looking at the science side of this. Yeah. Now let's just look at care in pregnancy, general care, and what my care was. Actually, I have kind of three sections here that I think are worth noting. Okay, so what I did was I looked at a normal pregnancy, and this would be anything that, in this case, where I'm looking at these 3 categories, geriatric pregnancy or high-risk pregnancy is considered after age 35. Yeah, it's really fun to go to the doctor when you're pregnant and have them write all over your forms that you're geriatric. So that was always a good chuckle of mine. But so this middle column here is really applying to women over age 35. What I'm considering normal pregnancy here is women under age 35, just for the sake of talking about what the care looks like. and then my pregnancy over here in the third column. So, all right, so normal pregnancy, you're going to be seeing the doctor every 4 weeks until you get to about week 36, and then usually every week until the baby's born. So you're going to be in the doctor's office roughly around 10 times. Okay. For a geriatric pregnancy, you start basically once a month through week 28, then you start going twice a month for a few months, and then the last few weeks you're there every time. So maybe around 14 or more visits if you're having a over age 35 pregnancy. And then for me, you can see I was there once in the first trimester, once in the second trimester, and one at 32 weeks. And then I went weekly for weeks 37 and 38. And I actually had Rion at week 39. So now I will, again, give the caveat. I am not a pregnancy expert. I am not advocating this for anybody, right? I went to the doctor 5 times. While I was pregnant was from November of 2019 through August of 2020. And everybody knows what was going on in the world at that time. Of course, we had a global pandemic and COVID was a huge factor. So part of the reason I didn't want to go to the doctor very often, and there was a huge, we had to weigh our options of pros and cons, was because obviously we didn't want me to be exposed to COVID as a pregnant woman. So that was certainly a part of why I was trying to stay out of the doctor's office. But in general, I was so healthy and I felt so great. I also didn't need to be there, right? I would also give the caveat that I have a husband who is a doctor. So obviously we did a lot of self-monitoring at home. And again, I'm not advocating that somebody reduce their physician care while they are pregnant. So let's talk about ultrasounds. For an under age 35 ultrasound, the average for women is around 2.2 ultrasounds. If you're over 35, you have an average of 4.2 ultrasounds. And I had 2 ultrasounds total, one at 11 weeks and one at 27 weeks. So again, everything was good. No reason, right? Why keep testing when you've seen the anatomy, you've seen the genetics, you know everything is good. There's no reason. And I was physically very strong and very healthy. And then prenatal testing. So if you're under age 35, you're going to have the normal things, right? You're going to have a CBC done, blood type and RH factor, urinalysis, urine culture. They're going to make you do a glucose screening test and an oral glucose tolerance test. And then you'll have your group B strep test. Same thing when you are over age 35, but they also recommend the first trimester screening and either CVS or amniocentesis to really look at the genetics. And then they still are going to make you do the glucose screening test and oral glucose tolerance test. Excuse me. Okay, so then let's talk about my prenatal testing. I did all the normal things because I was over age 35. I was age 37 at the time. We did do the first trimester screening and the amniocentesis to take a look at the genetics. And then the thing that was unique about my pregnancy was that I wore a CGM for the majority of the pregnancy. There were a few weeks where I didn't have one on, but between wearing a CGM and then also regular testing with the Keto Mojo to look at both, if I didn't have a CGM on, I was looking both at my blood glucose and my ketones, and also doing daily vital checks at home, right? I was doing blood pressure, pulse, O2 sets daily. Obviously Rob would listen for the baby and things like that, which was great to have. It's obviously a benefit of being married to a physician. And then this important note here, I refused the oral glucose tolerance test. So let's just talk about the oral glucose or just glucose testing in pregnancy, right? So they'll do a screening test. And if your glucose is over a certain amount, they're going to have you do either a 1-step or a 2-step oral glucose tolerance test. So the 1-step is where you're fasting and you do 75 grams of glucose, and then they collect your levels at 1 hour and 2 hours. Okay? So anybody who knows, if you are living keto, carnivore, keto, you're going to be insulin sensitive. So if you're insulin sensitive and you all of a sudden consume 75 grams of glucose, it's not going to go so well. So that's why I refused the test, because I knew I was insulin sensitive and that absolutely would have destroyed me, right? I mean, it would have just put me over the edge. So I didn't want to do any harm to myself, harm to the baby. So I refused the test. And I also took in my CGM readings to the doctor. And I said, look, do you see any reason why I would need to do this test, right? Just more as an education. However, because of medical legal liability, of course, I had to sign 1 million forms that I was refusing the oral glucose tolerance test. So really interesting how far we've come, or how, I guess, far behind we've fallen with gestational diabetes. So, you know, everything that I look at says that we didn't even really start collecting data on gestational diabetes until 2016. So the numbers could definitely be underreported for that reason. And then the percentage of women giving birth or having gestational diabetes at that point from 2016 to 2021 went from 6% to about 8.3%. And then the rate for mothers age over 40 years was almost 16%. So it's nearly 6 times as high for mothers under 20 years of age. I just think this shows us, first of all, we've had such a huge jump in those numbers from 2016 to 2021. And I read somewhere also that it jumped even higher during COVID and coming out of COVID, because I think a lot of people were not, we were home, we were in comfort mode, we weren't watching what we were eating. So I think those numbers may have even gotten exacerbated a little more during COVID. But it's just shown that these are not, I don't believe that these are naturally occurring in our environment, these jumps in percentages, right? There has to be something that we are doing, that we are consuming to make the numbers rise like that. So my biggest concern obviously was not being diagnosed or not having gestational diabetes for the health of the baby. And with everything that I did at home and keeping myself monitored with the help of Rob, I was about as far away from that as possible. So, okay. If we just talk a little bit about, common discomforts reported in pregnancy. I'm sure those of you who have children remember some of these. Maybe you were eating keto, carnivore, ketovore, maybe you weren't, but a lot of people obviously report extreme nausea, extreme vomiting, insomnia, bleeding gums and tooth pain, heartburn is a really common one, fatigue, constipation, breast tenderness, frequent urination, leg cramps, hemorrhoids, backache, dizziness, headaches and migraines, swelling of the hands and feet is a huge one. Okay. So let's compare that to what I experienced in my pregnancy. Like I said, I had nausea from week 7 through 16, which would be a normal, period during that first trimester that we would expect. I had one instance of vomiting, and that was actually the day that we went offshore fishing when I was 23 weeks pregnant. It was quite choppy offshore. So I actually vomited that day. I think we could call that seasickness rather than anything due to my pregnancy. I also had occasional reflux when I was lying in the supine position starting at about week 28. And then I had leg cramps on 2 different occasions when I hadn't consumed enough salt. So one of the things I did for that was I actually drank the Relight drink from Redmond, Real Salt, for those of you who know that. It was very helpful in getting me through those 2 instances where I had leg cramps during pregnancy. So overall, if you just think about, stories you've heard of good pregnancies, bad pregnancies. I mean, I considered myself to be extremely lucky, right? I was never uncomfortable. I was never uncomfortable. And we'll talk about my weight gain in a second, but I didn't have the normal outside of the nausea, which we would totally expect, not the vomiting and not any of the other really, upsetting discomforts that people report in pregnancy. I actually have a lot of friends who had such rough first pregnancies that they actually don't want to get pregnant again just because of how uncomfortable they were in pregnancy. So I considered myself to be very, very fortunate. Okay, let's talk about weight gain in pregnancy. So according to the Institute of Medicine, okay, these are the typical weights, right, or recommended total weight gain that you would have experienced during pregnancy. So my BMI is around 20 to 21, so I would be considered in the normal weight category. And so I was supposed to gain somewhere between 25 to 30 pounds in pregnancy, according to the Institute of Medicine. So let's look at my journey. Okay. So just a couple pictures. I'm big on pictures for any of you who know me. I love family photos, but I also love when I'm telling stories to show picture evidence. I think pictures speak about 1,000 words. So let's just look here. The reason I chose these increments 24, 32, and 37 weeks is because if you look across from left to right, this was 10 pounds, 15 pounds, 20 pounds. So I was 10 pounds, I had gained 10 pounds at 24 weeks, I had gained 15 pounds at 32 weeks, and then 20 pounds by 37 weeks. And my total weight gain for the entire pregnancy was 21 pounds. I started showing at about 14 weeks. I'll never forget this picture here. I was actually in San Francisco Bay Area. I was working a large deal with Stanford Children's Hospital at the time. COVID was coming in hot and heavy to our country. This was the end of February, 2020. And this is when I just started showing. You can just see me start to showing there at 14 weeks, okay? I took this picture and this was my last work trip before our company told us everybody go home. There's no more travel, which I was actually very thankful for because at this time I was so nervous about being exposed to COVID and all the stories, and especially because I was on the West Coast of the US and the proximity to China and where, we thought the entry point would be. It was very frightening to me. So I will never forget that picture, but that's when I started showing at 14 weeks. Again, I had no food cravings, which was awesome. I didn't have 1 ounce of swelling throughout the entire pregnancy. This was me at 39 weeks, actually, the night before we went to the hospital to deliver. And I, like I said, felt great. Even on the way to the hospital, I will tell you that I told Rob that I could actually do a 4th trimester. And I wasn't kidding. I mean, I literally wasn't uncomfortable, didn't feel any different than normal. I totally could have done a 4th trimester of being pregnant. Okay. I wanted to put this picture up in the right corner because this was actually at my maternity photo shoot, where you dress up cute and you show your little belly and you do professional photos. So we actually went down to the Keys. That's where we got married, in the Florida Keys. So we went back to the same spot we got married to take our maternity photos. And I was at, this was 5 weeks before I gave birth, and I was doing jumping photos. So here I am with a big pregnant belly, and I was doing jumping photos. Again, I'm not advocating anybody do this, but that just shows you how good I felt physically, emotionally. Everything was just great. Also important, I think, here to see, again, pictures worth 1,000 words. You see the pictures of my legs. On the left side, this was at my my baby shower about 6 weeks before I gave birth. And the picture on the right was actually the week before I gave birth, no swelling at all in my legs or feet. Okay, so let's get to birth and postpartum. So our birth was a planned cesarean section. So I had a hypocoiled umbilical cord. So Rion didn't have a ton of space to move around. So for that reason, we decided we would go ahead and do a scheduled C-section. Also, Rob is a surgeon, and he's pretty strong belief that it's best for baby and child. So we actually made that decision early on, and we actually chose our OBGYN based on his technical surgical skills. So that'll show you something about being married to a surgeon and what's important. So we chose him, we had it scheduled on a date, we preordained the date. And so therefore, like I said, we're driving into the hospital. We know that we're going in for the C-section, and my body did not go into labor. Okay, so that means I did not produce the oxytocin, and I didn't have that peak of prolactin that women who actually go into labor experience. Okay. I did have a very pain-free birth. Even after the surgery, I took 1 ibuprofen that day just because the hospital made me, but otherwise I wouldn't have. And then I got to go home less than 24 hours later. Again, not advocating that that's the way to go. They knew that my husband was a surgeon, obviously, and felt comfortable discharging us in his care. And obviously I really wanted to go home. I tried very hard to breastfeed that first day. I really wanted to get that colostrum milk, but I barely had any seep out of the breast. I mean, barely any. So that night, Rob went home for a brief sleep. And when he came back the next day to pick us up to go home, he realized that Rion really hadn't gotten any nutrition. So he gave him his first bottle of formula that day. And because I was so determined to breastfeed, I left the hospital feeling very sad. So I will say mom guilt is real. Those of you who are moms probably know this. So it was very, very hard for me to go from what I would say the most perfect pregnancy to losing the battle with the thing that was the most important to me, which was breastfeeding my child. So obviously having lived the ketogenic lifestyle and knowing the benefits of breast milk, I was bound and determined that I was going to breastfeed. So, and I would tell you that Rob and I even had conversations leading up to the birth about what if I can't breastfeed? You know, that would be the worst case scenario. What should we do? So we looked at, you know, should we buy breast milk? And then because we were in a global pandemic, we realized you can't actually get any freezers. The freezers had sold out because everybody was hoarding food. And you literally could not find a freezer. People had been selling their old deep freezers in the back of their garages for thousands and thousands of dollars, and there just were not any available. So we would have an issue with keeping it, obviously having a way to keep it. And then I also had a cousin who, it's funny, she's now actually a carnivore, and she's studying nutrition. But she used to tell us, because she used to drink Mountain Dew like it was her job. I mean, 4, 5, 6 Mountain Dews a day. And she says she can remember when she was at work at the bank, when she came back from maternity leave and she was pumping, she would put there was a couple of them that had been pregnant at the same time. They would put their breast milk in the fridge at work. And she would literally look at her breast milk next to the other mom's that was there, and hers would have a green tint to it. And she swears to this day that it was because like her diet was basically Mountain Dew. So that played in my head as well. What if we buy breast milk from somebody who has a horrible diet? So that was a concern. So in the end, we just sort of prayed that it would work out, that I would be able to breastfeed. And you know, that was our plan. Unfortunately, it didn't come to fruition. When I was having so much trouble breastfeeding, I had a lot of guilt that it was my implants that were causing it. I had had breast implants about 10 years prior to giving birth. So that guilt was weighing very heavily on my mind. I couldn't figure out why I would have gone through that surgery if this, would happen to my child all these years later. So I will also say that breastfeeding was very, very laborious. I would put Rion on the breast for 30 to 40 minutes. We'd take a 20-minute break to play, do tummy time, cuddle, read books, and then I'd put him back to sleep. Then I would go pump for another 20 to 30 minutes. I would clean and store all the milk. Then I would have maybe 45 to 90 minutes, if I was lucky, before the next cycle started all over again. It was a constant. I felt like breastfeeding was just consuming me, and I was only getting a few ounces every time. So it was just extremely frustrating. So what we did was that 3 days postpartum, when I was having so much trouble, we actually started a medication called Reglan, which is actually for reflux, but there is supposedly an off-label use of helping with milk production. So we decided that it was worth it to try that, and I started a dose, I think it was twice a day of Reglan. One of the major side effects, actually the only side effect listed, I think, on the side of the bottle was postpartum depression. And Rob and I both decided that because I had basically no risk factors for going through postpartum depression, that the benefit far outweighed the risk. And so we decided to go ahead and start the medication. So probably one of the worst decisions of my life, and certainly October 2nd, 2020 was the worst day of my life. I will say that the weeks leading up to that day, I was starting a downward spiral. I had these feelings of my life was being reduced to 3-hour cycles that I just couldn't escape. I felt like the walls were closing in on me. Obviously, the breastfeeding failure was weighing very, very heavily on me. I felt like I was suffocating, and I felt like my life as I knew it that I would never be myself again. Prior to, actually even during my pregnancy, I would leave the house on a Monday, travel all week, maybe 2, 3, 4, 5 different cities, come back on the weekend. And then Monday I'd started all over again. All of a sudden I was reduced down to this 3-hour cycle that I couldn't break. It was extreme isolation because of COVID. I had nobody. My parents couldn't get there. My sister couldn't get there. Rob was working. And so I was home all day, every day by myself. And then in Florida, it was also hurricane season. So it was raining nonstop all day, every day for about 3 weeks. And I was definitely taking a downward spiral. Nursery rhymes would actually haunt me when I would try to sleep. They would just play over and over in my head and not allow me to get the rest that I needed. And it was just the most miserable feeling ever. I would start texting Rob's office manager. Thank goodness she's an angel. I would start texting her at like 3 p.m. and just say, is he on track? Is he going to leave at 5? I would be counting down the minutes till he was home because I just didn't feel like I could do it by myself. So October 2nd was a Friday night. It was just an absolute nightmare. The postpartum really hit me at that point like a ton of bricks. And when I look back on it, I really feel like it could have been a postpartum psychosis because it was such an acute, I obviously was having the downward spiral, but then all of a sudden the anxiety and everything that came at the suicidal thoughts, everything that came along with it just hit me like a ton of bricks. If Rion started crying, I couldn't even look at him. I had to look away. Rob had to take over complete care for him because I had so much anxiety. I was physically shaking, so I couldn't hold Rion at all. That's why you see him. He could lie on me, but I couldn't hold him, like be standing or sitting and holding him. I was definitely suicidal because I just didn't see any way that my life could get taken out of this hell that I was experiencing. And I couldn't sleep, I couldn't eat. So all night I would just pace around. I definitely had irrational thoughts. But luckily I knew exactly what it was when it hit, right? So I told Rob, I have really bad postpartum depression and we need to get me help. He would force me in the car, take me for a drive. We went for a walk on the beach, which was the first time Rion was ever going to the beach. And I literally did not want to be there. I couldn't even enjoy being outside, which I usually would love, and being near the water I would usually love. It was the most horrible thing that I've ever experienced. I don't wish it on anybody, not even my worst enemy. And I told him, you cannot leave me alone because if you leave me alone, I will not be here when you come back. So that evening was a Saturday night. I begged him to check me into the psych ward. I told him, there's no way I can do this. I'm not going to make it through the night. And all I could think was that when Rob checked me into the psych ward, they would realize how crazy I was. They would take Rion away. I would likely need my sister to come take care of Rion so that Rob could continue to work to provide for him. And obviously we'd get divorced. All these things, even though I knew I was going through postpartum depression and the thoughts were irrational, it was like my brain was playing a trick on me. I couldn't overcome it. So what did we do? Going from October 2nd, 2020, we had to put together a plan, right? So the treatment plan. Obviously, support system is critically important. So I relied so heavily on Rob, obviously, initially, and then later my mom. We drove to the pharmacy. We had tried a couple times the day before to get prescriptions filled for some antidepressants and benzodiazepines. The benzos are heavily controlled substance, and because we have the same last name, we're obviously family. They would not, Rob tried to talk with the pharmacist, and they would not fill those prescriptions for Rob. So we went to, I think we tried 2 pharmacies on Saturday. On that Sunday morning at 6 a.m., we went to a Walgreens pharmacist. or the drive-through window at Walgreens, and a woman pharmacist came to the window. And I literally think she was my angel, because Rob told her, this is my wife, the same story. She got really, really bad postpartum depression, and she has an appointment with a psychiatrist, which I did, but the psychiatrist was virtual because it was, again, during COVID, so virtual appointments, and I wouldn't be able, even if they prescribed me something on Monday, I wouldn't be able to physically get the script for several more days because he was up north. So told her the story, and she actually said that she had the most awful postpartum depression, and she knew exactly what I was going through. And so I think that, again, I pray every day that she saved my life. So she gave Rob the prescription for a very, very small amount of Ativan. And then I also had the antidepressant prescriptions filled as well, which it's not a problem. That's not a controlled substance. So I took an Ativan, and within 30 minutes, I was literally relieved of physical symptoms that I didn't think I could make it through. So I actually felt like I could breathe again, and I felt such a relief. It was like night and day. I felt actually so much of a relief that I started questioning whether we should even call my family for help, because I thought, okay, if it's just this really quick acute issue, but luckily we decided to go ahead and still call my parents. And then my mom flew out the next day, again, during middle of COVID, and they're elderly. So that worried me greatly as well. But she was on a plane the next day to come help. We also, like I said, that same day we started two antidepressants, actually Zoloft and Wellbutrin. They're a different class of drugs. I discontinued the Wellbutrin about 3 weeks in because we realized I didn't need it. But we did stay on the Zoloft because that takes a while really to kick in, and it takes a while for you to wean off as well. So that was sort of the other piece of what was going on that same day. So I love this picture of Rion and my mom. It absolutely brings me such joy to my heart, but I feel so fortunate that she was able to be there. I would not have been able to do it without her, because the next 6 weeks, even though I got the immediate relief from the anxiety, and was able to, physically function again, the next 6 weeks were just awful. I barely could get out of bed. I still didn't feel like myself. I literally didn't feel like doing anything. I would go from sleeping to this chair in our living room. I would read my book, Baby Wise, talks about the routine and, eat, play, sleep, eat, play, sleep. I would just read that book like incessantly. I would just continue reading the chapters. That's all I would do. Sleep, go to my chair, read the book, go back to sleep, read the book. It was really horrible. It felt like everything was insurmountable. During that 6 weeks, I actually got a notice in the mail that my driver's license was coming up. It was going to be expired, so I needed to go and renew the driver's license. And you would have thought somebody just delivered the worst news in the world to me. I did not see how I could possibly muster up the strength and emotional buoyancy or anything to go in to get my driver's license renewed. It just like put me over the edge that I would have to do that. Excuse me. So that was a very, very trying time. I was trying to do things for emotional buoyancy, singing and dancing with Rion and talking with my mom and Rob were really, really helpful to me. But there were other things that I wasn't doing anymore, like physical activity became non-existent for me. It had always been really important in the past. I had been a runner. I liked doing Orange Theory fitness, yoga, all kinds of different physical activities. And I just did not feel like doing any of it. And then obviously a piece of the treatment plan was giving up breastfeeding. It just was taking such a physical and emotional toll on me. And I still wasn't producing enough to be beneficial to Rion. So I had to give it up. It just was, I had to put my mental health over the breastfeeding, which was devastating to me. And then after 5 weeks, my mom had to leave. And on November 13th of 2020, I snapped out of it almost as quickly as I had fallen into it. So all of a sudden that day, I felt so much better, so much better. But again, being on the Zoloft, it's a very powerful medication, and I needed to be very careful in weaning off of it. The minute that we started those antidepressants, we had a plan for how I was going to wean off and when I was going to wean off, because they can be very addictive. And also going back to the Ativan, I was deathly afraid to take that medication because of how addictive it is. Luckily, I only needed it for about a week. And then I never took it again, but I had to get through that acute onset of that anxiety. And then we had to be just very smart about how we weaned me off of the Zoloft. Okay. So additional options that people who are experiencing this can have, just a note that perinatal mood and anxiety disorders are actually the #1 complication of pregnancy and childbirth. So more so than gestational diabetes. So I think it's just important for everybody to know this is not unusual. Obviously mine was definitely, there were a lot of contributing factors, but I think the side effect of the medication, if I had it to do all over again, that's the one thing I would definitely change. Not sure that I would have experienced it, or at least maybe gone downhill that quickly or that severely. But again, you can't go back, you can only go forward. So what were some of the other things? I personally went to 1 support group session and 1 private therapy session. I think those are great options for some people because I knew that this wasn't myself. I knew that I was having irrational thoughts. I knew that, everything was going to be okay on the other side of this. I knew mine was largely chemically induced. I just wanted to get back to feeling better, so a lot of the group therapy is really focuses on telling women that they're not alone and other people experience this. I knew that people experience this. I knew it was very common. It still didn't help me get back to being myself again, right? There's a lot of reading materials out there. One book that was recommended to me was Good Moms Have Scary Thoughts. Really quick, easy read. So that was, again, I knew everything that was in that book, but maybe just reading it on paper and seeing the pictures may have done some good. Getting back to physical activity was hugely important to me. I still didn't feel like it. I remember one day my mom was in town and Rob said, "Get your shoes on, we're going for a run." And I literally did not want to do it. I was kind of kicking and screaming, but I said, okay. And I did it. And I think from that point forward, just became so much better. And then sunshine really helped once it started being out of hurricane season and daily smiles and baby giggles. I really started to come into my own with being a mother. So that's really my story of postpartum depression. I think it's hugely important. I don't think we talk about it enough. I'm always happy to share my story or talk with anybody about it. If you want to email me or message me on Instagram or whatever it is, because again, if I can help one other person not have to feel the way that I did, I would do it in a heartbeat. So then let's talk about infant and toddler nutrition. Okay. There's 3 fuel sources for our bodies. I think we all know that. Alcohol, sugar, and fat. Okay. Obviously, the preference to fuel our body would be the fat. So that's when you're in a state of ketosis. And during the 3rd trimester and birth, both mom and the fetus are in a state of ketosis. And obviously, that means babies are born into ketosis. We do know that the mother's milk is low carb, high fat, which keeps that newborn in ketosis throughout nursing. And it's important to note also that the macronutrients of breast milk, about 55% fat, 6% protein, and 39% carbohydrates. And we also know that brain development starts at 6 weeks gestation, and the structural brain continues to develop until about 5 years of age. I think this is really important because this is why Rob and I decided that we were going to raise our baby ketovore, is that we were really concerned about the brain development, obviously. Excuse me. It's growing. The brain is growing at such a rapid pace. Is even in that, especially that first 3 months of life, right? It's about 64% larger than it is at birth at 3 months. And then the 2-year-old's brain is about 20% smaller than an adult brain, but has 50% more synapses. So these are all really important, factors in knowing that first 5 years of life is so critically important to brain development. And by 5 years, it's about to 99% of its adult size. So that's really why we wanted to go down this nutritional path with our child, is we really wanted to give him the absolute best chance of brain development. So let's talk specific to Rion's first year of life. Okay. So Again, because of my issues with breastfeeding, for the first 6 weeks, I was doing a combination of breastfeeding but I was having to supplement with formula because he wasn't getting enough. And then 6 to 10 weeks, he was mostly formula with just a small amount of banked breast milk that we still had available. I will say we searched high and low for a formula because all the ones available in the US are crap. The two that I have here, they are still not perfect by any means, but they were really the best of what we could find. And they were both out of Europe. So the HIPP and the Leluca, we started with the HIPP, we found that one first, and then we ended up finishing with Leluca. We liked it a little bit better in terms of its content. So those are the two we found. Again, I would love to hear what anybody else has found out there because we did a lot of research and that was really the best at the time we could come up with. From weeks 10 to 16, he was exclusively formula fed, which that point in time was just killing me because, again, I had wanted so desperately to breastfeed. And then right at 4 months, is when the GI tract is actually mature enough to handle food. That's when we started real food with Rion. The reason being we were so desperate to get to that point because we were only doing the formula feeds at that point. So literally December 22nd, which was exactly 4 months after he was born, we started with his first food, which was ribeye steak, as you can see here. We would give him large chunks that he could hold in his hand. Being able to hold it in your hand is important so that he doesn't choke, obviously. And the bigger piece, the better. And at that stage, really, they're just gumming the meat and getting the juice out of it, right? They're not actually, they're not masticating, right? So that was his first introduction to food. As you can see up at the picture at the top, this is actually some pureed chicken. So then we started into the purees, and I would add fats to them. And so a lot of his meals look like this. It would be a pureed meat and then some of his formula. Again, you see another piece of a different kind of meat down here. It was like a sausage stick. And again, he would just hold it and gum it. You got to stay very close to them, obviously, make sure they're sitting fully upright. Watch for choking. Obviously, as a speech language pathologist, that's a lot of what I did in my field was dysphagia or swallowing disorders. So we were very cognizant of that. From months 8 through 12, we were really starting then to do non-pureed foods. But softer foods, right? So maybe the eggs were scrambled with extra moisture in them, but they weren't pureed any longer. And then we started reducing formula as well. We would do a little bit of veg when we were pureeing his food. And from months 4 to 8, he was still consuming maybe 24 to 32 ounces of formula. And then 8 to 12 months, probably about 10 months, maybe he was doing about 16 to 20 ounces of formula. So he started doing less and less formula. I do think it's important to note 4 months is when he had his first bite of ribeye steak. 12 days later, he actually cut 2 teeth. And by the time Rion was 8 months old, he had all of his teeth. So that's why we were really able to start the non-pureed foods at that point. So now we fast forward to Rion being 1 year old. So now he's actually officially a toddler. I will show you this picture here. This was his first birthday picture. Most families do a cake smash where they, put him in front of the cake and they smash it. Well, we did a steak smash instead. So he had a lovely ribeye for his first birthday. Now, this is the toddler nutrition sheet that the pediatrician hands out. So again, I don't think it's quite as bad as the women in pregnancy sheet that they hand you. But again, you'll see here that they're talking about 2 to 3 servings of fruit every day. The whole grain, 6 servings. It's like, oh my goodness, this is what we're feeding our children who are in active, rapid brain development. I did like the fact that they had fats listed here. I thought that was important. But again, they clearly missed the boat on some things, but it certainly wasn't as bad as the food and pregnancy handout. Okay. So what does Rion actually eat? Many of you may follow me on Instagram, so I just took a quick snapshot of some of the things. I try to post a lot of what he eats, just if other parents are out there doing the same sort of thing. So he eats what we eat, right? We have air fryer chicken with the skin on. He may have some vegetable from time to time, coleslaw or cucumbers. Sometimes we just have sushi bowls that don't have any vegetables in it. Looks like some mushroom and Swiss burgers there. A lot of eggs. We do a lot of eggs with Rion. It's a perfect food. lots of bacon, right? I tend to cook 2 pounds of bacon at a time. We keep it in the fridge. We eat it throughout a week. And then the picture on the right, this is actually a real world example. So Rob's actually in his Jacksonville, Florida clinic this week. It's his remote clinic. So I should say weekend. So we drove up last night, and this is what I actually went to the store and picked up last night because we're going to be out of town for a few days, right? So we have breakfast sausage, some cheese slices, cheese sticks, some biltong for our friends over in South Africa. This purple thing on the left, that's a package of biltong, some turkey lunch meat, and of course, whole milk. Is this perfect? No, right? I mean, the lunch meat is processed, right? Would I love to not have to give him that? Yeah, but it's the best I could get late last night when we were coming into town. So you can see that this is mostly carnivore. That's how Rion tends to eat. Mostly carnivore with just a little bit of veg. I will say he absolutely loves veg. And I personally think it's because it does contain some carbohydrates, and he never really consumes carbohydrates. So we have this frozen package of organic vegetables from Costco in our freezer. And there's a lot of days when he's going and pulling at the freezer saying veg, veg, veg. So that's sort of his treat, which a lot of his friends' parents think is hilarious. They're like, how do you get your child to eat vegetable? And it's kind of hard for me to explain. It's actually a treat. His vegetables are actually treats for him, right? So it's just a different world from what they feed their children, right? Most days he really isn't hungry until about even 10:30 or 11. I mean, he has the food available. It's there if he wants it. He wants to play. He wants to go do other things. So it's not like we're having him fast. It's just how he is naturally. And really he could get by with 2 meals a day. We tend to sort of make him do the 3rd meal a day just because we know he's growing. But in reality, he would eat something late morning and then, 4 or 5 o'clock, and that would be it. By the way, I included my receipt up here from the groceries last night. Now, this is our discount store in the US, right? But I don't know if you can see it that small, but this food was $18, what you see here, 18 US dollars. That's about 328 Rand in South Africa. And then I thought it was funny too, if you can imagine this package of biltong here, it's about 2¼ ounces or 64 grams, and it was 73 Rand. So can you imagine paying, and it's actually crap biltong because they don't put enough fat on it. So if you can imagine paying that much. Okay. This is just a good sampling of what Rion actually eats. And now how is Rion's growth? So he's always been at every doctor's appointment over the 92nd percentile for height. He's always been over the 98th percentile for weight, and his head circumference has always been over the 85th percentile. Again, not sure if it's due to his, diet. Obviously, genetics play a role. Rob's a big guy. He was a rugby player. So I'm sure some of it is genetics. Now, this is his best friend, Miles. Miles is 6 months older than him, and Miles is mostly raised on sugar. So again, I'm not saying that this is due to his diet, but Rion is a really, really strong, solid boy. And Miles is very skinny. And Miles will not, his mother was one of the ones that said, how do you get Rion to eat vegetables? Because he will not touch a vegetable. So he's about probably 95% carbohydrates. All right, finally, just some parental observations. Again, whether or not these are due to his diet, we may never know. But I think that they are some interesting things that we've noted anyway in Rion's growth thus far. So he never had a yeast diaper rash. Like I said before, all of his teeth were in by 8 months, excuse me. And I actually put this picture, it was actually a video, so I tried to still it and take a screenshot. It's a little blurry, but because he was laughing so hard, it gave you a good view of his teeth. So his teeth are actually very straight, and they were all in by 8 months. He really was never sick at all. The first time he got sick was when he went to the pediatrician for his wellness visit. He actually got RSV. Other than that, he's been very healthy. And even when he was sick that time, he didn't act sick, right? He was still running around, playing like crazy, and he was happy. He knew all of his shapes, colors, numbers to 14 and about 10 or 12 letters by his 2nd birthday. Again, look, he's got my husband's genetics, and I'm praying that he has my husband's brain because my husband's very brilliant. So I certainly don't want him to get mine instead. But so whether or not this is genetics related or diet, or maybe some of both, and he also has excellent memory and abstract thought and problem solving. It's really interesting to watch him solve a problem. And And then he's also a very calm child. He's not, running around. He's definitely active, but he can sit and focus on a task for quite a good amount of time. And then finally, he's just a happy child. Again, whether or not this is due to a combination of factors, but we are very fortunate that he's a happy child. And that's really all I have for you today. This was just last weekend when we started to take the boat out. I thought that was a good one to end on. And I just really appreciate you all today. Again, just my story. I don't think any valuable science to share that you don't already know, but for what it's worth, if it can help one person, I really appreciate it.
Awesome, Janae. Thank you so much. And I just want to start by, I want to say you started by saying you were not the global authority on keto pregnancies, but I completely disagree with you. I've had 2 pregnancies and I can't remember the facts that you've put on here and the way you've detailed nutrition. So definitely, and come on, steak smash cake, like that was just amazing. So, I really have to start though by saying that you are getting so much love from this community. And your story, I think, resonates with so many people because pregnancy is such an isolating experience and such a hormonal flux and so much expectation that when something goes wrong, I don't think we prepared. But just to say that you went through this through an incredibly isolating time without the ability to connect, with lack of sleep, with the breastfeeding problems, with sunshine that was gone, that we know is so important for mental health and physical health, on medication, with COVID and the uncertainty. And so I just want to send so much love to you and thank you for sharing a very vulnerable part of your soul. And, there's so much love coming from the community, from Dr. Neville, Wellington, Victoria Webster, Tia, Jane, Masuda, Nuzetti says that, she says, I can so relate to this. I failed big time. I will put that in inverted commas on breastfeeding my eldest, such an emotional postpartum period. Then she turned out to be a colic baby, unable to tolerate cow's milk. Such difficult feeling to deal with even till today. My eldest is already 17 and I'm still feeling guilty every now and then. So it's just something, the mum guilt is real. And I think it's the emotional work or the emotional toll of mum. Dads love the children too, but mum definitely takes on so much of that. Tamsin, Sarah, Yana, everybody talking about, and Adrian saying, I wish I'd known this 28 years ago. Everybody just thanking you for sharing. And it's really wonderful to see what a lovely, lively, adorable, chunky monkey Rions turned out to be.
Yes.
So, I've also got 2 children that are mostly carnivore. I want to say ketovore, and I've got the same story with my son over 90th centile. So I really do feel that, you've done so much. And I think a lot of people, like you said, there's so much nausea and there's so much difficulty. How did you find that period in your life, that first trimester, that can be so difficult? How did you find it relating to other pregnant mums or even your own family?
So because we were a bit surprised when we got pregnant, weren't expecting it. And then we also went, like I said, about 14 weeks. When I was 14 weeks, we went into lockdown and then the world became virtual. So we actually didn't tell anybody. We actually did tell my parents at Valentine's Day. We wrapped up their Valentine's present, which was a pair of little shoes. So we told them, but didn't even tell my own sister, right? It was just my parents and actually Rob's parents in South Africa. We told both of them, but kept it very quiet, right? I was advanced maternal age. Rob was definitely advanced paternal age, right? So both of us potential genetic issues, potential loss. There was just so much that could go wrong. So we actually didn't share it with anybody, which became even more isolating, right? Luckily, I got off the road from work, and then I was sitting like I'm sitting with you all day, every day. So even when I did start showing, nobody knew it because all they saw was from here up. So it was very isolating, and I couldn't even talk to anybody, or didn't even want to talk to anybody, because I just felt the risk was too great with my age and the other factors that could be going on. So it was rough. And I will say that it wasn't just morning sickness, it was all day sickness. So, and I really had to force myself to eat at that point. You know that it's very important for the baby development, that you must get nutrition in, but you don't feel like it at all. So you're literally forcing yourself. And if I had a little break in time where I didn't feel quite as nauseous, I would run to the fridge and, make my grilled chicken salad or whatever it was, or I'd have it on standby ready to go. That if I did have kind of opportunistic moment, that I could go get some nutrition in me. So it was rough. It was very rough. And then not to share it with anybody. And then I'll add another layer on that, right? During COVID, a lot of times pregnant women, they get to dress up cute, and they get to buy maternity clothes, and they get to have the little outfit that they go to their doctor's appointment in. And everybody wants to touch their belly and all these things. And it didn't happen at all, right? I went to my doctor's appointments in scrubs. With gloves and masks, right? It was we had no idea where we were going in terms of COVID. So it was really scary. And so I didn't get to do any of those fun, cutesy pregnant things. And so for that reason, we didn't tell anybody else outside of my parents and Rob's parents until I was 24 weeks. So that's really when we made our announcement. So that's a long time to go with that sort of complete isolation, besides your husband.
Yeah. I was watching your YouTube video Rob made with how you just hacked the whole formula thing and all of the, finding finally was it the Dutch formula that you found and had shipped? And it was just wonderful to watch Rob and you talking about adding the omegas every second day. And I think it spoke to the fact that we're humans, and before formula, we would feed children real food. And that brings me to a question that Mas has asked. She says, thank you so much for sharing so vulnerably, Janae. How did Rion's gut tolerate the ribeye as a first food? So Mas at the moment has a 5-month-old baby. And secondly, did you season the pureed chicken?
Okay. So how did he tolerate the ribeye from a GI perspective? Fine. We didn't notice any difference with his bowel movements. Again, at that point, he's really just getting the juice off of it and the gumming, the gnawing of it, which I'm convinced had something to do again with those early teeth popping out, and then later his full, dental development. But didn't notice anything different initially with his bowel movements. I mean, he's always been very regular, which is part of, I think Rob always says, have you ever seen a lion who's constipated, right? So, from that respect, GI wise, totally healthy. In terms of the seasoning, yes. So pureed chicken's a little bland, right? So we would add a little salt, right? I would always have Rob tell me how much was right. You don't want to over salt with these babies. A little bit of salt, a little bit of butter, a little extra olive oil, avocado oil, something like that to add some extra fat in. But yeah, we did use a little bit of seasoning in some of those meats. But I will tell you, I think that pureed chicken picture that I showed you was maybe on Christmas Eve that year. I think the ribeye steak was the ribeye was 2 days before that. It was so new to him. He loved it, right? Even though it wasn't, I think that was about as bland as they come, just plain old pureed chicken that day. Occasionally I would have to add some water or maybe some chicken broth to it because it's a little too dry, but it was new to him, right? He loved it. The same thing with the ribeye, even though he was just gnawing it, no teeth, he absolutely loved it. It was different and new and exciting to him. So I will also say that, I don't know, maybe some of you all follow the brothers out of Poland. One of them, when Rob was in Poland in September giving a talk at their conference, they had a 4-month-old at the time, And so we had a lot of chats about how we kind of started that journey, and they send us pictures every so often of all the new things she's trying. Same thing. You'll see the videos they send me and she loves it. It's new, it's different. She absolutely loves it. So I think, give it a try and see.
And are you giving Rion any bone broth?
We do, but sometimes we do give him, but it's not like a regular part of the diet. Sometimes if I'm making, I don't know, roast or something, I'll actually put it in the pot with it. And then we just have it kind of as an au jus or something. So, but it's not that we're intentionally like a cup of bone broth every day or something like that.
Awesome. So there's a comment here from Adrian. She says, Peter was born at 28 weeks. And it is so sad that I was led to believe it was okay to eat a thrift pack of apples a day. Until today, I blame the preeclampsia and pancreatitis on the apples. Maybe he would have been a better chance if it had not been for an apple a day. Yeah, I just looked at your picture of what a pregnant woman should eat, and it was just shocking. So, that's why I'm so grateful that you shared the information on the pregnancy, because so many people have difficulty in their pregnancy and what to eat. And I think we sometimes fall prey to the craving and the fact that you can just lie there and ask your husband to go get you some ice cream at 2:00 in the morning. And so it's so great to see that your journey, yes, it was emotional for that period postpartum, but your pregnancy was just so terrific, and no doubt is a huge part of the reason why Rion is so beautiful and healthy. Thank you so much, Janae, and thank you for sharing. And I any questions, I'm sure there'll be lots of questions, we'll forward them to you. Thanks so much, Janae.
Such an honor. Thank you.